My name is Michael Neely. I'm a chiropractic physician, and in 1999 I was diagnosed with a sero-negative rheumatoid arthritis. That essentially means that my blood work was negative, but I had all the clinical symptoms of rheumatoid arthritis. For me, it started out as swelling in my feet, both in the cuneo and navicular joints, and then I couldn't walk for about 3 days initially. Severe pain for a few weeks after that. And over time that progressed to full body pain, and then became what's called a migratory monoarthropathy. And that means that the joints would swell up intermittently, either my knee or my thumbs or my feet or both knees occasionally, but usually just one joint after that initial presentation. And it slowly progressed to the point where I would be in pain all the time. Pretty much full body pain, sort of like a fluey ache kind of feeling, and then the joints, when they were swollen, it'd be very difficult to use whatever joint was swollen up in particular. If it was in my feet or my knees, I'd have difficulty walking. If it was my hands, like my thumbs, I would have difficulty using my thumbs. At the time, I was in chiropractic college, and I was practicing martial arts and teaching a little bit, and that slowly began to slow down because of the problems from the arthritis. For many years, I tried to manage that through dietary changes, over-the-counter non-steroidal anti-inflammatories like ibuprofen and aspirin, high dosages of fish oils and supplements, and really probably the only thing that made a significant impact was the fish oils, around 12 to 16 grams a day. But that was hard to sustain for a long period of time. But that's what I ended up doing after making significant dietary modifications. About 3 or 4 years ago, when Dr. Griffith moved back to Olympia, I had been doing a lot of research on DMSO personally, and read about Dr. Jacobs' work from Oregon Health Sciences University, and asked Dr. Griffith to do a trial of IV DMSO on me, because the arthritis had progressed to the point where I had to stop doing much physical activity at all because I was in so much discomfort. I had been teaching martial arts, non-contact form type of martial arts, sort of almost like Tai Chi, and even doing that I would be in pain for 2 or 3 days afterwards. Working out was very uncomfortable, and I would be in pain afterwards, and not like a muscle pain, but pain, uncomfortable pain. So Dr. Griffith did 5 DMSO IVs on me over, I believe, about a 2-month period, and which is actually below what Dr. Jacobs' protocols are, but we were just trying it out on me, and I wanted to see what the impact was. And after the 3rd IV, I was out working on my farm with my friends, putting in 1,500 feet of fence, and for the first time in many years, when I got done, I realized that I wasn't in pain. My hands didn't hurt, and I only had some minor muscle pain, which was just discomfort from not using things like I used to. So that was really dramatic, and we did 2 more after that initially, and then I was really good, and I over time I think I've had a few more since those initial 5, but I've gotten back to pretty much, the majority of the stuff that I did before all this started back in '99. I can work out 2 to 3 times a week now. I am back to training in martial arts like I used to, and it really has given me my life back. So for me, when I have patients come in with autoimmune arthritis, anything from rheumatoid arthritis to lupus, anything that I think may have an inflammatory component or may potentially be useful or be affected by the DMSO, I recommend that they try it. And Dr. Griffith has had quite a bit of success with other patients, and with the history of Dr. Jacobs' work at Oregon Health Sciences University, I can't recommend more to people that are hurting to at least give it a try, because it could give you your life back and let you live the way you love.